Tucson, Tennessee. Wow. So we've just been doing the head and neck, and now we're going to go and do the, the head and jaw, I meant to say, and now we're about to do the neck. People are calling in. How you doing, Justin?
I couldn't be doing any better.
Hey!
Yeah,
Okay, great.
excellent.
So I just wanted to show you a few of the materials that we're using. So here is Travell Simon's book here, and we're going to be using volume 1, and we'll be working with these muscles today: the sternocleidomastoid, the gastric, the medial pterygoid, platysma, longus coli, longus capitis, and the supra and infrahyoids. That's the front of the neck.
Otherwise known as front of the neck muscle.
Front of the neck muscles. So this is a nice, interesting book about Janet. She wrote this. She started this whole field of myofascial trigger point therapy, along with Dr. Simons. And we have some other doctors here. That Dr. Devin Starlow, one of our doctors, she's written this really wrote this book here, Healing Through Trigger Point Therapy. And of course, I wrote the trigger point therapy for low back pain, and it came out in Korean too. So this is the Korean version. This is the Korean version. Isn't it cute? And then we also have the trigger point therapy for low back pain in Japanese. So here we got it right here. And one of our people that started the field, of course, also is Bonnie Pruden.
Mm-hmm.
Now we're also using these great posters. So we're using our Rosetta Stone of myofascial trigger point therapy, the trigger point referred pain chart.
So number 9, eh?
We're doing number 9. That's correct, number 9. And on here it shows all the muscles that cause pain, referred pain to that area, and also it shows the nerve roots and the numbered range of motion test that we'll be doing.
Oh, yeah.
So let me put this to the side for a minute. Yeah. And then, so here's all the muscles in big. So today for the throat and front of the neck pain, this is broadcast number 7. And we're doing protocol 9. And the nerve roots we're going to check today is C1 through C6, and we're going to do range of motion tests 1 through 4 and 8. So that's what we're up to today.
Great.
It's going to be wonderful, right?
Yes.
Yeah.
Yes. Of course.
So we're going to learn how to treat ourselves. So I was going to give everybody who's here a bit of information on taking care of themselves. One of the most important things is warming up, then doing the compression, then moving. So so I was going to hand this to everybody, so you guys can have one copy of all these, and all of you could have one copy of the throat and front of the neck pain
Protocol
number 9. So everyone could have that to take with them today, and so you could have everyone have one of these. Yep. Okay, great. Okay, so I had some quiz questions that people can answer by the end of the class today. Okay. So here's the quiz questions.
Okay.
Okay, so name a muscle in the anterior neck that flexes the neck, laterally flexes the neck, rotates it to the same size, and prefers pain to the posterior neck. So that's a quiz question. And another one is trigger points in the blank muscle. But don't look at it, the answer.
Oh, the answers are there? I didn't realize the answers were there.
Trigger points in
I'm
the
a
blank.
natural-born cheater. What can I say?
Trigger points in the blank muscle can cause you to feel like something is stuck in your throat and will not go down. Okay?
Something is stuck in my throat will not go down?
That's right. And another one here is the trigger points in the trigger points in the blank and the blank
Look at that.
can cause difficulty swallowing. So blank and blank can cause difficulty swallowing. Okay? And then we already got that there. And then, how about symptoms of postural dizziness? Imbalance can be due to trigger points in the blank muscle.
Ooh, dizziness. The dizzy muscle.
The dizzy muscle.
Everybody
The
needs
dizzy
to know the dizzy
muscle.
muscle.
The dizzy muscle. Unresolved posterior neck pain may result from not treating trigger points in the anterior neck muscles called blank and blank. Okay?
Oh, I know that one.
Okay, trigger points in the one of the infrahyoid muscles can cause elevation of the first rib, causing compression of the brachial plexus. So which one of these anterior neck muscles would it be? So there's a few little quiz questions that people could be thinking about while we're going through all our self-care and stuff. Okay, so let's do a little warm-up of our necks before we start treating ourselves. So I have these two little heating pads, so we can do that. So we've got, and we can use those. So for you, we're going to give you a little heating pad.
Okay.
You can put that right there.
Okay. Yeah.
And we have our Fomentech bags
Excellent.
called Dwayne and Angie at Fomentech, and they will help you out.
Excellent.
Dwayne
Thank
and
you.
Angie.
Yeah, Dwayne and Angie.
Yeah. So this is made like of a space age plastic that's really thin, and there's two
Yep.
layers, and it keeps it really warm. And he made it. Dwayne made it for his wife Angie, who had fibromyalgia, and he would put it all over her bed so that she could lay on a bed of warm water and not have any trigger points activated while she was sleeping. So, okay, so we've got. So we're going to treat. So the first muscle we're going to
front
treat.
of the neck.
Yeah, the front of the
Put
neck.
on the front of the neck.
front of the neck. First one we're going to treat is the sternocleidomastoid. It is the most likely one to cause front of the throat pain. And so let's go ahead and take a look at that muscle. So here's a nice picture of it right here. Here's your sternocleidomastoid right here, the sternal division, and here's the clavicular division. So it's a muscle that starts on your breastbone and goes to your head. So it's the breastbone to the head muscle there.
Okay.
And let's look at its pain pattern. So it can cause front of the throat pain right here. So you can see it right there. So it could cause you to feel like you have a sore throat, and could cause you to feel like you have front of the throat pain. So this is this muscle right here. You can see it starts on the breastbone and then goes to the skull. So that's your sternocleidomastoid. And we'll treat both parts. We'll also treat this part that causes head pain and ear pain. But here's the muscle, the part that actually causes the front of the pain in the front of the throat. Okay, so let's take a look at that one together. And so how do we find that muscle? So we're warming it up. Good. You're warming it up. Great. Okay, so this is the muscle. Here it's it starts right. So feel that part. Feel your ear, and then go right behind your ear. That's where it attaches there. Well, I have hair there. Okay. And then it comes down, 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 and goes right here to your breastbone and attaches right here. So it goes from everyone. So it goes from here, right there where the base of your skull is, over to here. And we're going to treat it. This one we're going to treat by doing a little compression like this. So we're going to go ahead, and so you can sit on your hot water bottle now if you want. It's good for sitting on.
I'll put it on your
So,
back.
oh, that's good too. Yeah.
Put it on my
You can just
lumbar.
put it on your lap or to the side.
Yeah, that's right.
Put it on the shoulder. Shoulder's good. Okay. So we're going to treat the sternocleidomastoid. Usually I like to sort of like pinch it this way. So I put one finger here and there and pinch it just like that. So this is called pincer compression. So what are we going to do? We're going to do pincer compression. So we're pincing it here. So we're going to let's start close to the where it attaches onto the skull, and we're going to go ahead and give it a little compression. Breathe and relax. And what if it's not painful? Then maybe we'll move on to another spot. So let's turn a little bit to the same side. So whatever side we're working on, we're going to turn to the same side, because that's lengthening that muscle. So when we're pressing on it and we find some painful spots, what might that indicate? That we have painful chemicals stuck inside the muscle. And what we're doing now is we're squeezing and displacing those painful chemicals and letting the blood supply passively move in. And the blood supply has all the nutrients that the muscle needs to relax. And it also, when you push those painful chemicals out of the neuromuscular juncture where the nerve comes to the muscle, then the nerve can work properly and tell the muscle what to do. If it's all filled with those painful chemicals, then the muscle doesn't listen to the nerve. It just sits there and goes like that when the nerve tells it to do something. So by pushing those painful chemicals out of the muscle and letting the blood supply in, you're reconnecting the nerve with the muscle. So let's go to the other side. So again, we're going to find that area. So we're going to find the ear, then go behind the ear, and we're going to find that mastoid process of the temporal bone there. And then we're going to go ahead and squeeze it right there, and then we're going to turn to the same side, because when you turn to the same side, you're stretching it and making it longer. It's so critical to make this muscle longer if you expect it to not express its pain pattern. Remember, it causes pain in the front of the throat right here, and difficulty, and soreness when swallowing. And let's keep turning and looking over your shoulder and really stretching that sternal division of the muscle that starts at the collarbone and goes to the skull. The collarbone skull muscle. But it's really, we really prefer calling it the dizzy muscle. Right?
That's the dizzy.
That's
This is
the
the dizzy muscle. This is the dizzy muscle.
Dizzy muscle. All right. Remember that for the test.
Yeah, you have to remember that for the test. This is the dizzy, nauseous muscle here. Yeah, it is. Yeah. So now we're going to get the part that's just behind it now. So here's the clavicular division, or the collarbone division, or the part that goes from the collarbone to the base of the skull. So this part here, we're going to press right onto it with our fingers. So I'm going to use 2 fingers, and we're going to do just straight compression on it. So find our collarbone, and just above the collarbone right there, that's where the collarbone division is. And we're going to go right there. We're going to go up, breathing and relaxing. Well, it's not painful. Then we're going to move to the next spot. Oh, what if that's painful? Oh, we're going to stay there for a little while. Breathe and relax. Hold that spot. Oh. And we're going to, now for this section of the muscle, having your head turn and go to the other side is the way you stretch it. So I'm stretching it going to the other side. Now we're going to go up a little higher and go a little further to the other side.
You're laterally flexing the other
Yes,
side?
I am.
Okay.
And it's coming up here a little higher. And a little higher. Great. So that's we stretched and treated 2 divisions of this on whichever side. You treated your right side, and you treated your left.
I did both.
Oh, you did both? She got them both done? Okay. So we're going to do a little range of motion stretch. So we're going to go over and really look over our shoulder, and really look over our shoulder, and ear to our shoulder, and ear to our shoulder. And really look over our shoulder, and really look over our shoulder, and ear to the shoulder, and ear to the shoulder. Okay, so let's take a look at, so we did do both sides. You're right.
We did both.
We did both sides. Okay, how can I forget? I was going to do the other side again.
Well, we had to do the second part on the other side.
Yeah, we did do it. We did.
Yeah.
Oh, we missed one part. Okay,
Yeah,
you're right.
so I just did
you're
that
correct. You're
afterwards.
correct.
Right.
Okay, we're going to do the second part of the set. So
Second part of the second side.
So we're going to do the little collarbone to the base of the skull. We're going to do this section on the other side. So sometimes when one hand is working, I have the other hand helping it. So here I'm going to use 2 fingers, find the collarbone, come right above it, and press right into that sternocleidomastoid collar division here. Collarbone section. Or for those of you that like Latin, the clavicular. And let's go ear to the opposite shoulder. Now if it's not painful, we'll just move on to the next spot. If it is painful, we're going to hold it for several breaths, breathing and relaxing. Breathing and relaxing. And seeing, what you want to do is see if while you're pressing on the painful spot, does it go a little further and a little further? Oh, then you know you're getting onto the really good tight spot that when you're pressing on it, pushing the painful chemicals out and letting the blood supply in, you're getting really good response. So let's keep it going up and go up a little higher and all the way to the base of the skull. And it's nice to press right on the spot where it attaches onto the bone. Is one of the places that's good to treat. Good, so let's go ahead and let's stretch it, and stretch it, and stretch it, and stretch it. Good. So that's the collarbone division. So what do you think of that one?
Good.
Good, good.
Oh yeah.
He's stretching, he's stretching, he's stretching.
And
He's
I can.
stretching. Okay, the next one.
Nice.
Now, next one we're going to treat is the digastric muscle. So let's take a look at a nice picture of that one, Justin. Let's see if we have a nice picture over here. It's not there. We're going to have to get it out of the book.
It's right here.
Oh, there it is. I see it. There it is. Okay. So let's
We've
go
got it
ahead.
right here,
Oh, it's gonna. I want to look at it there. Yes. And then let's look at it over here. You can see that it causes throat pain right here, right underneath the chin, and it comes up this way. And remember last week we did tooth pain.
Mhm.
It also causes tooth pain, but it may only be causing some pain in the throat here. Now, this muscle can cause you to feel like you have a lump in your throat. And it could,
question.
and it could be cause you to feel difficulty swallowing. Yeah. So this is one of the ones that's important. So did you take a look? Did you take a look at what it looks like, the muscle there? Right there. So it's right underneath there. So let's go right underneath our chin, right here, and let's feel that muscle. And we're going to go right under the chin, press in, and we're going to do some of its jobs. Let's open our mouth. Let's feel it opening our mouth. Let's feel that. And let's feel it protrude and retract. Let's feel that. Good. And let's go towards the hyoid bone. So let's come towards the hyoid bone and press right on it. Feel your little hyoid bone, and feel how it holds let's swallow. Look at it, feel how it's its contribution to swallowing. So let's go up where we were before. Let's see how when we swallow, what does it do? So you can see it's working while we're swallowing. Okay, and it comes right here to the hyoid bone, and then from the hyoid it goes up this way, all the way to the same spot where we just went to with the sternocleidomastoid. So it goes right to the base of the skull. So that's our little muscle of our digastric on this side. Let's go ahead and look at it on the other side. So let's look at the inside of the chin right here, and let's feel it do some of its jobs. So let's open and close, open, and let's swallow. So feel how it holds elevates the hyoid bone. And let's feel, now if you find a painful spot on it, then you're going to hold it for several breaths. But I didn't have any painful spots on it, so I'm just going all over on it. But I didn't stop and say if you had a painful spot. If you do, then you want to stay on that one for several breaths, breathing and relaxing, pushing those painful chemicals out. So it comes here and attaches onto the hyoid bone. Let's feel that hyoid bone. Swallow. Let's go up to the base of the skull, looking for a painful spot. Can you find a painful spot on it? You can? Oh, let's feel it do some of its little jobs. Let's go ahead and protrude and retract. Protrude, retract, protrude. Okay, good. And come up to where it attaches onto the same spot on the skull. Good. So that's our hyoid bone, and that causes some, our muscle attaches onto the hyoid bone, our digastric, and it causes some pain here in the front of the neck. Okay, so that's a good muscle to know. Yeah, that's a really good one.
We have a question how we know we're on the hyoid bone.
Okay, so let's feel the muscles below the bone and above it, and let's go ahead and let's just feel that how it goes up and down. So let's swallow. Can you feel the little bone that goes up and down?
Yeah, it's a little ring on top of the thyroid cartilage. You have all that big cartilage like your Adam's apple, but right above it there's a little ring above it called the hyoid bone.
And you could just feel it right there. So you just so the way you would find it is just come right there, and you look for it right there, and you can feel it going up and down. What else would you say about it, Justin?
Yeah, that's what I would say. There's a whole bunch of muscles that attach to it.
So a lot of the muscles we're going to be treating right now, several of the muscles that we're going to be treating today either come like this and attach down onto the hyoid bone and elevate it during swallowing, and then a bunch of them here below, called infrahyoids, or below the hyoids, they hold onto the hyoid bone and anchor it down at different points while we're swallowing. So it's a place so the hyoid bone is a place where these muscles can attach. Also, these muscles underneath the chin also move the tongue around and allow us to move the tongue. And some of these in here also could cause some of the pain in here. So I'd like us to treat the suprahyoids and the infrahyoids, some of these tongue muscles, and we'll get rid of some of the pain that we can also have in the front of the neck here too.
I do have actually something to say about the
Oh,
hyoid, which
oh,
is
okay,
that
go ahead.
in applied kinesiology, it has a very important significance because there's a lot of muscles attaching to it and giving feedback into the brain, such that really strong feedback right up into the central nervous system, such that when there's a muscle imbalance from side to side, it can cause a lot of confusion, mental confusion, disorientation, nightmares, in addition to all the pain that you experience. And it can also cause an incredibly cool form of losing your voice. It's pseudolaryngitis. So I've had people who have lost their voice, they can't talk, and then we work on the hyoid muscles, and they say, oh, that's very painful. And instantly their voice will come back as you're working on the muscles. So, yeah.
Great. So
Not a place most people work, but
no,
very important.
it's very important. And these muscles that attach on it are very important.
Yeah.
So another muscle we're going to treat is the medial pterygoid. So we're getting the order that they cause pain in the throat. So the sternocleidomastoid most likely, the digastric second most likely, third most likely is the medial pterygoid. So we're going to treat that one next. And we did, and all of us are warming up the front of the neck here. And so for this one, we're going to come and look for. Oh, let's look at let's look at a picture of it.
Okay.
So let's look at a nice picture of it. Here's our medial pterygoid, and see how it's attaching onto the corner in the inside of the jaw, and then onto the skull there. So we're going to go from here to there, and do some of its jobs. It helps to open the mouth, and it also help if one working at a time. It'll have the jaw go side to side. So it's used in mastication, because it helps you to really move side to side like that. Okay, so we're going to treat the medial pterygoid. Oh, it could cause really bad sore throat. I mean, really bad. All over the back of the throat, sore throat. So really all through here, it gets really bad sore throat. So many children, their parents know how to treat this muscle, and whenever they get like a feeling of sore throat, they tell their parent and they start treating this muscle. So we're going to come find the corner of your jaw, okay, right here, and we're going to roll under and into the jaw. And then we're going to do some of the muscle's jobs. Let's go open it. Oh, we can feel it doing its job. Okay, and then we're going to go side to side. I think I hear Claudia. I hear somebody there, yeah. You could go check it. See there. Okay, and let's go a little bit more in and a little bit more underneath. And feel it opening. Oh, I just felt a soreness in the back of my throat. Imagine that. I must have a little trigger point there. Okay, really feel it opening and also going side to side. Nope. Okay, it's imaginary. I imagined it. Okay, so here we're going to go on to this side next. So we're going to see. So again, we're going to take a look at the medial pterygoid. So that's where it would be if you cut away the bone. It's underneath the corner of the jaw, and it's attaching onto the skull. So it would be nice to maybe look at a picture of that. Where we put that? Maybe it's okay. So if you let's go ahead and let's go underneath.
We could show it on the skull.
Yeah.
Oh, yeah.
I was going to say, do we have a skull?
We do have a
We
skull.
do have a skull.
Yeah.
We have a nice skull. Isn't it great to have a skull? Okay, so here is where it attaches, right here. So it's attaching right here, and then it attaches over here, just like that. So it comes here from the corner, and it comes over here and attaches onto the skull.
That's why when it contracts, it moves the jaw.
It moves the jaw to this
opposite
way.
side.
Yeah. So when it contracts, it goes this way. You
Yep.
see? So it contracts and goes to the opposite side.
Yeah, they're pinched
Yeah,
together.
yeah. So here, I could show you, Frederick. So here, it starts here under the corner of the jaw, and it attaches right here onto the skull.
Wow.
Yeah, right onto the skull. Okay? Great.
Yep.
So it's nice to have a skull.
Muscular system is truly amazing.
It's nice to have a skull. Okay, so let's go treat it on the other side, and let's do some of its jobs. So let's go underneath and press up and out to on the bone, on the jawbone.
Oh yeah, the out part really helps.
Press out like that, yeah. So that gets it. Okay, now see if you notice any soreness in the back of the throat, and let's feel it do some of its job. So it's open and close, and it's open, close and open, and let's go side to side. And let's protrude, retract, protrude. So there, you feel it. Did you feel any
Oh yeah,
any
some
painful
soreness
spots?
in the back of my throat on that
You did
side.
feel it.
Yeah.
Oh, he felt it.
Yeah.
Yeah, not you. Yeah, I only had one side I felt it. Yeah. So that's a good one, and it causes really bad soreness in the back of your throat if it potentially could.
Mhm.
So one reason or another.
Yeah, I can feel it.
What if you were always putting your head forward like this, and you're always making these muscles tight here?
Mhm.
Or what if you were always clenching your teeth?
Mhm.
Okay, you might, if you're always clenching your teeth, you might cause this muscle to get dysfunctional. So there could be a lot of different reasons that you could have trouble with this muscle. And
I
those would be a
just felt
couple
that
of them.
referring to my ear.
Yes.
My
It
dentist
causes,
says
oh,
that I
so,
clench at
Yeah.
night.
so it's one of the, he said that?
Yeah.
Yeah, okay, so
So
this
he
is
built me a rubber thing.
to stop you from wrecking your
Your
teeth.
teeth, right.
But you still might clench.
Right.
So you could still, so one way to stop clenching is I have you treat these muscles like we're doing right now before you go to bed, and by working the tension out of them, maybe then you won't want to work it out at night, okay? So then you stop doing the grinding and the clenching, possibly.
Right.
Maybe it's encouraging. And I've had many people stop grinding and clenching because we've trained them to do that. So hopefully it can happen for everybody else.
Excellent.
Okay, so we're going to treat the platysma muscle. Okay, so this would be the platysma. So we have a nice picture of that too. We drew some pictures of it. Oh, she's got a picture for you.
Very thin muscle, almost
Yes,
in
it
the
is.
skin.
Yes, it is.
Very thin.
Yeah. Good.
Is that whole thing the muscle?
Yeah, that is, isn't it?
It's
Isn't
a
it
sheet
great?
of
Could you find
muscle
some
all the
big
way.
muscles?
Yeah, it's
Wow.
a big sheet of muscle. It goes all the way down from your chest up
Wow.
over to your chin.
It's incredible, isn't it?
Yeah. It's huge.
So the platysma, there it is. So she's going to, can you show us the
Another
referred pain
picture.
pattern of
There's
it?
another picture.
The referred pain pattern? Yeah, you have to turn the, you turn the page, yeah. Anyway, this is the platysma. There it is. It causes referred pain in the front, like a little bit underneath the chin again, and also into the cheek. Okay, and you see where it is. So some people can really tighten that one up. So let's, like weightlifters, right? Like this, you know. Can I tighten that one up? Or like, okay, so this is it here.
be my problem.
Okay, so we're going to start right on the chin, see how it attaches onto the chin. So we're going to go right along the chin, and we're going to do pincer compression on it, and just lift up the muscle right over the chin. So we're going to lift the muscle right over the chin, right there. And let's go ahead and use our other hand on the other side. And then we're going to squeeze, come down underneath the chin, and we're going to do little squeezes all through the underneath of the chin. And you can feel, try to feel the platysma doing its job. Feel it, try to go like this, feel it has its job. Feel that. But you know you're on your platysma. Let's come on down. Keep coming down. Now you can also feel how it helps to open the mouth. So feel how it's really, how it contributes to opening your mouth. You can really feel it. And that, and you're feeling some of the superinfrahyoids underneath a little bit too. Let's come down lower. And let's see if we can make these lower parts work. So let's feel them. Let's see, ooh, I can make those work. Ooh, I can feel it. Or if you feel a part that doesn't work, then you go, ooh, maybe I got to make that work. That part's not working. So feel it here. So we get right on those platysmas. and then come on down over your collarbone and pinch right here and like lift it up and move it around your collarbone here. Great. So let's give it a little stretch. Let's take our chin up, up, chin up. Let's contract down. And chin up, and chin up. Great. Okay, the next most likely is the longus colli. Oh, and we have some really great pictures of longus colli that we've got to show you. We just have to show you these great pictures.
One person was saying they couldn't tell if they had skin under their hands or the platysma.
Well, you can sort of know you're on the platysma because you can feel it doing its job. So here I can feel I've got skin, but the skin wouldn't tighten like that, you know. So you can feel. So let's try just the skin. Let's feel this, just the skin. And if I have just the skin, it doesn't contract. You see?
Uh-huh.
It doesn't. You can't get it to contract. But if you have a little bit underneath there, and then I can feel, oh, there, I can feel it. Now I can feel it working.
Mm-hmm.
So, oh, I can really feel it working, see? Yeah.
Yep.
So definitely, you can get it, you can definitely see it working. Okay,
You want to take this picture?
that's a good picture. I'm going to start with that one, but I was going to show a color picture as soon as I find it.
Longus colli. I think that might be one of the answers to a test question too.
Well, it is. It's one of the ones that causes significant back of the neck pain. So here I've got it a little bit in color. So here it is. Here's the longus colli muscles. So you see that they're starting at C2 and coming all the way down here into the T's. And then you see here, this is the longus capitis, and then here's the longus colli. And you see they're attaching onto the anterior spine. And this is the scalenes over here. So here, and they're not, so they span a few vertebrae, okay? And if they're short, they can pull the vertebrae, together on one side or the other, and could cause some discs to maybe push out the other way, or also could cause pinched nerves and things like that. So here we're going to take a look at them. And what's their job? Okay, their job is to flex and bring the chin to the same side, like this. So that's their job, so that's their stretch. So this would be their contraction. So what I like to do is put my finger here on the longus capitis and here on the longus colli, and see if I can get every group to shorten. So I'm trying to get every one of these. So I get my finger on this section, and I get it to come here. Look, take a look. So I get my finger on this section, and then I shorten, bring the chin to get to the chest and shorten it. Then I get my finger on that section. Then I bring my chin to my chest and I shorten it. Then I bring it to this section. So I keep bringing it and bringing it, and I feel every one of these sections to make sure that they're actually doing their job.
Mm-hmm.
Okay. So I'll test that on all of us too. So let's start low. Let's go right here low down into the collarbone right here, and we're going to go right there low, and let's go chin to the chest and feel that muscle, and then feel it stretch. How did that feel, Stephanie? Okay, you can feel that, Stephanie? Okay, so if it hurts, what does it mean? We probably have some sensitizing chemicals stuck in there, right? What do you think? Not so much?
Not too much.
Uh-huh.
Yeah.
What do you think over there?
Not so much yet.
Okay, so
But I know you got to keep working which
yeah.
part.
Okay, so yeah, that little section you're good. Okay, so let's go ahead. Let's go a little higher. So let's go. So we're going to find the esophagus here. So we're going to get just to the side of it. So we're going to find it. So that's here. So here's your vertebrae. So the esophagus would be right in front of this, and then we're going to go just to the side and press in and onto the vertebrae. So the anterior. So we're going to find the esophagus, come just behind it, press in and towards the vertebrae. And then we're going to, let's go ahead and bring our chin down to our chest and take it back. Okay, how does that feel? What do you think?
Fine.
What do you think? Oh, she's noticing him.
Yeah, I'm noticing a little bit.
So this is the one that causes, that is really a big help for unexplained back of the neck pain. So it's one of the biggest causes of back of the neck pain that never goes away. Never ever goes away. Because why? We never treat the longus coli and the longus capitis.
And you said it's very important for cervical disc pain, right?
Very, very important.
Yeah.
Because
Applied kinesiology would agree with that. They always treat the longus coli if there's a cervical disc problem.
it's very important. Yeah.
They say that it pulls the vertebra anterior on that side.
And anterior to the one side.
Yes, anterior to the one side, and
Yes.
that causes a lot of uneven compression on the disc.
Correct.
See, now I'm feeling it as I get up higher.
No, a little higher. Okay, great.
And I feel it.
Now, as we go higher, we're going to go a little lateral because that's what the capitis does. So the capitis is a little bit more lateral. Okay, so let's take a look at the other side. Okay, so again, let's start low, and let's go right into the notch right here. We're going to go start and go all the way in and towards, and like feel it go. You can sort of feel that muscle contracting and stretching. And feel it contracting, feel it doing its job. Feel it, have your head go down, feel, oh, I can feel it doing its job. Oh, I can feel it stretching. Okay, so go up a little higher. Again, let's find the esophagus. We're going to go just to the side of it and behind it, right there. And now we're going to chin to our chest, to our collarbone, and up, and down, and up. And let's go up a little higher. And we're going to go, now we're right on it, and we're going to contract and press right onto it, just like that. And we're looking for, what if I pressed there and it was really painful? What would I do?
Stay on it and do some deep breaths.
Right.
That's it, that's it. Breathing and relaxing. Okay, let's come up higher, and we're gonna press right onto it, and come back. Let's come up a little higher, and up a little higher, and up a little higher. And let's go a little bit lateral, a little bit towards the outside of the capitis. Great. Okay, so this is a really good one. It can cause pain throughout the whole throat area. It could cause pain, and it could cause pain in the back of the neck. So it could go pain in the front, but it causes so much other kind of pain. It causes eye pain, and it causes ear pain. It causes pain in the back of the throat and in the front of the throat. What do you think of this muscle?
Sounds like a pain.
Can you imagine? It causes ear pain, it helps to cause ear infection, and it causes a lot of pain problems. And again, it's one of the causes of that unresolved pain in the back of the neck.
The thing I like about it is I think it really distinguishes you if you're able to work on the longus coli, because again, almost nobody does.
You often, correct, you very frequently don't see people treating the longus coli, that's true, or the longus capitis. Okay, so another group that we want to treat is the supra and infrahyoids. Okay, so this is the muscles that hold the hyoid bone down, or hold it in different, for swallowing, and also they all help to open the mouth. So let's all feel how our mouth opens, and can feel how some of these muscles down here also help us open the mouth. You can feel them doing their job.
So infra below, and then supra up here.
That's right, and there's our hyoid bone there.
Yeah.
So great.
Ring-like hyoid bone right there.
Super. So here's one in color. So these are sometimes called the strap muscles, and they're kind of named by where they attach onto things. So here it's attaching onto the hyoid, and it's attaching over here onto the sternal. So you can see that so what we're going to do is we're just going to grab a hold of so we're going to go right to the center of the throat here. We're going to just grab a hold of them, and then we're going to go short, bring our chin to our chest, and go chin up to the ceiling. So we're going to go through. Here's the what's this one called here? The
Omohyoid.
omohyoid. So this one is one that attaches onto the hyoid and comes this way and attaches over here, but you can't see it, but onto the first rib, and sometimes can lift up the first rib and cause compression of the brachioplexus. So that's an important one there. So we're going to treat all these little strap muscles in the front. So let's go to the hyoid bone here. Let's go right here to the hyoid bone, and let's go right below it, and we're going to grab onto the strap muscles. So let's feel them stretching up to the ceiling. Let's feel them contracting down. Let's feel them swallow. Can you feel them do their swallow? Okay, so you could feel them working. Let's go down a little bit. So feel your esophagus there. And let's go right over it. And we're going to grab those muscles. This is pincer compression on the strap muscles here. So we're going to go ahead and let's feel how they stretch. And let's feel how they contract. And stretch. Okay, let's go a little higher. Oh, a little lower, I meant to say. We started high. Okay, a little bit lower. And let's feel the esophagus. Let's go just to the side of it. We're going to grab onto them and let's feel, oh, are they letting my nose go up to the ceiling? Are they stopping my nostrils from going up to the ceiling? Are they letting me come all the way down to the chin, or to the chest? So let's go down a little bit more. Now let's go right to the collarbone. And we're going to go right to where it's attaching here. And we're going to go, let's feel how it's stretching up and down and up. Okay, let's go to the other side. Let's start just below the hyoid bone right here. So let's go ahead and feel that right there. Let's grab a hold of them. Let's feel them do the swallowing. Oh, I feel them doing swallowing there. Good. So we're on it. Yeah. Mm-hmm. And let's see how they stretch. Oh, it stretches pretty good. And let's see how they contract. Pretty good. Okay, let's go down a little bit and see if we find anything a little bit more tighter. And let's swallow. Okay, let's go up. Feels pretty good. Let's go down. Doesn't hurt. Swallows good. No pain. Okay, let's go ahead. Let's go down a little bit. Let's get right a hold of it. And we're going to go down and up.
Did we talk about the referred pain for these guys?
Well, we didn't talk about it very much. No, we sure didn't. So they cause pain throughout the front of the throat. So they'll cause pain throughout the front of the throat. Yeah. And let's go a little bit more lateral. So let's think of where the omohyoid is. So let's go ahead. Let's feel the hyoid, and remember it attaches over here. Let's see if we can find that sternal notch here, and let's see. So it can help to lift up the first rib there. I can sort of feel it right there, and that's our omo. And let's go ahead and let's treat that its attachment here, and then come down through here. Now, I did have one person that had only one dysfunction in their one omohyoid, okay? And this was a young person, and this is how they got dysfunction of their omohyoid. I'll show you. They were laying sideways looking at a TV game, and they were going like this and holding their head up. And so they got a really bad spasm of the omohyoid with the joysticks like this. They had the head up like this, so they.
Yeah.
I don't get very much dysfunction of one omohyoid. So that's what they had. Yeah. So let's go ahead. Let's go to the hyoid. Let's come over here to the sternal notch, and over here to the first rib. And let's go ahead and let's press on it. And let's come a little bit inferior. And a little bit inferior.
Again, Sharon, wouldn't you agree that these are muscles that you're not used to palpating?
No.
So in the beginning, it could feel like you only have one muscle called the front of your neck muscle.
That's what it feels like.
It feels like that in the beginning. It's very normal, very, very normal. We talked about, using your imagination to increase your skills of palpation, using the images, using the motions that Sharon's describing, the swallowing, the everything, plus your imagination sometimes. You visualize what you're touching before your hand learns to feel it, and that really increases your intelligence and awareness of these things. So don't worry if it just feels like one front of the neck muscle. Eventually, Sharon's not joking. You can actually feel the individual muscles.
That's right. That's right. Okay, so some of you are getting together in maybe Hawaii or Nashville or other parts of the country, Indiana. And so at this point, we're going to pair up for people that would like to learn how to treat each other. So this is so far the self-care. So we're going to just do a little bit more self-care, but you're going to start to get ready. We're going to start to test each other, and then we're going to treat each other. So those of you that would like to do that, that's coming up next. Okay, so we're going to do a little bit of range of motion exercise for the muscles we just treated. So what we want to do is just the motions that we just did. So we want to bring our chin to our chest and get our chin to our chest. We want to get our nostrils up to the ceiling. So nostrils get up to the ceiling. We got their ear to our shoulder. And we really want to rotate and turn and look over to the side and turn and look over the side. And we want to really, in order for some of these muscles to really get their full range of motion, you actually have to do this. You actually have to look, oh, what's going on up there in the sky? And then you look down, oh, what's going on underneath this drawer? What's going on underneath there? And then you've got to look at your ear. Oh, I got my ear on my shoulder. Who's over here? Who's over there? What's going on over there? So that's what I've been doing is throughout the day as I just use my eyes and my neck, and I really look around. And I'm always so happy when I have to turn my head to look for a car, and I goes, oh, I was always so happy I could turn and see what's in behind me. I can see.
And I can't. I got more work to do.
Well, can I add something really cool about
Okay,
range
go
of motion
ahead.
too?
Okay.
So the brain operates by the use it or lose it principle too.
Oh.
And I can't remember the percentage, but it might have been as much as 60%. Of input to the brain is coming from all these little nerve receptors that are in your joints. And when your joint has full range of motion, you take it to that full range of motion, it activates the entire span of that area of your brain. And if you never turn, fully, then there's a part of your brain that never gets stimulated. And so if you just try as much as you can, you're actually increasing your brain activity. And they show that on MRIs, or EEGs, whatever they use. They show dramatic increases in brain activity and health through range of motion.
Wow.
Yeah, it's cool.
Fabulous.
Yeah. So, yeah.
Very nice.
Move it or lose it.
Okay, great. So we're going to do some range of motion exercises. So those of you who have the range of motion charts, we're going to do 1, 2, 3, and 4, and 8. So we can do those all together. And so let's take a look at, and what do we need for measuring?
Measuring tape, goniometer,
That's right.
fingers.
Fingers, right, we use all those.
Okay.
So we can have a measuring tape, so we'll get a measuring tape out. And a goniometer, great. Okay, so we're going to go ahead and measure a little bit. So let's come over here, we'll take a look at you. Okay, so here we're going to take a look at her range of motion. So one way we're doing it is we could do it with our fingers. So we could measure from the earlobe to the acromion to the shoulder. So go ahead and ear to your shoulder.
Wow, that's
And so that's
Hey.
like one finger.
very good.
Very
One finger.
good. Wow.
Okay, so that's really good. So one finger. Let's go to the other side. Again, was 1.5 fingers here on this side. No, two, maybe two. 1.5 to 2. Okay, that's very good, right? Okay, the next is so next we're going to do chin to the chest. That's test 3. So here. So we could get it so today if we could get it so she could squeeze more. Oh, she's squeezing more now.
Very
Can you
good.
ever get your finger back
I
out?
can't get my finger out. Okay, that's a pass. She passed that one. Okay, we're going to get our chin to the ceiling. And what you're trying to do is just get at least our nostrils up to the ceiling. And there she is. She's doing that. So that's pass. So we did them all there. That's great, great, great. And then we're going to rotate. So we're going to rotate and we're going to get our nose to the acromion, to the shoulder. So we're looking at getting the nose to the shoulder here. So we just got about 2 fingers difference here. Let's go ahead on this side. And again, the nose to the shoulder.
Oh, that was really
no,
going.
no, this one, no fingers. Okay, no fingers. He's going to clap for you there. You did good there. Okay, standing, we're going to look at your jaw. So we're going to look at, let's look at the opening. Go ahead and see if you get 1 finger in, 1 thumb, 1 knuckle. Let's get 2. Okay, so that's not too hard, right?
Mm-hmm.
Okay, so how does it feel? Good,
Comfortable.
good, good. And then the other thing is we're going to look at her movement of her jaw. So let's go ahead and look at so open and close and open. And then we're going to feel it. So we're going to feel her movement. So here we're going to go. Open and close. Okay, so I can feel that's a little tighter on this side. So what's happening is when she opens slowly, the 2 sides aren't exactly, it's one side, but feels very smooth though, and I don't hear any noise. What do you think?
Yeah, a lot better than last week.
Yeah. So there hardly any noise. Okay, so that's good. But this masseter over here. But we're not treating masseter today.
Yeah.
But we'll see what these other muscles' contribution is to that. Okay. So, but you can always keep working on that masseter there when you have time. Yeah. Okay. So we're going to set up the table for treatment. And then, so you guys can set up your table for treatment, and you could take a look at your test in all your tests on your different people, and then let's take a 10-minute break, and then we'll be back.
Thank you. You make me feel so much better.
Okay, so we're going to test to look for any super sensitive spinal segments. Which ones will we look for today? We're going to be looking at which ones do you think today? C1, C2, C3, C4, C5, C6, and C7. So let's go ahead. We're going to see if we can lift this up. So here we can lift it up here pretty good. Lift it up here, pretty good, pretty good. Just all the way down to the T's. So all the C's are pretty good, but just all the way down here. So now she's a little bit tight at T1, T2. So you're doing pretty good in this. So one of the things we do is we treat the supersensitive spinal segments that could be causes hypertone in the muscles that this segment distributes to. So like all the longus colis could be, if this was tight, could cause them to be activated in the front. Okay, so we've done pretty good. We'll just do a little bit here. Let's take a look at your neck. Let's take a look at yours. Okay, so can you hold it while we're looking at her?
Yes.
So let's look at yours, and let's have your head up like that. And here you can see that we have a very tight, supersensitive spinal segments right here. So here, and she's had a few injuries to her neck.
Yes, many whiplashes.
Yeah. So here, as you can see, so one thing for her would be to get these to be released as well. So let's take a look at Stephanie. Let's take a look at those 2 spots in Stephanie, and we'll see what we can do for that. So for Stephanie, let's go ahead and let's treat them standing for a moment. So here, we're going to look right at those supersensitive spinal segments. So here, I'll take care of that. That's good. So we found them right here. Okay, so we're going to treat the little rotatories and multifidi muscles right along the spine. So we're going to go there. How's that feel, Stephanie?
Feels okay.
Okay. Feels okay. So we're going to add a little stretch to it while we're pressing. And there, right, I've got a spot now. Yeah, she agrees. We've got the spot now. Okay, and then we're going to tip it down a little bit and turn it a little bit.
You got it.
Okay, I got it right on there. So let's check it now. Let's see if it lifts up a little easier. Yeah, it does. Okay, so now we're going to we'll do the other side before we do our final checking. So we're going to go over on this side, and we're going to go ahead and treat the multifidis on this side and the rotatories. And right there. What do you think of that, Stephanie? Good. Okay, so let's go ahead and let's check. Let's just have the head not so far. So just come this way. Thank you. Okay. Oh yeah, look at that's better. So it's lifting up a little better. And we'll treat it a little bit also while we're laying down. But I wanted you to see where I was when we were treating him. Mm-hmm. So today we're going to treat the front of the neck muscles today, right?
Yes.
Okay, muscles that cause pain in the front of the neck. All right, so we're going to set up the table for you to lay on. And often we're going to do a heat sandwich. So we're going to put heat underneath and heat on top. So let's go ahead and have Stephanie go ahead and lay on your back. And we're going to put a little heat on your tummy. Great. Okay, so, oh, well, I think you're pretty good. You're pretty good. Okay, so we're going to treat the sternocleidomastoid again. So this causes, remember, it causes pain here in the front of the throat. So we're going to take a look at the sternocleidomastoid, and you can see here it is. Here it is here. So the muscle that goes from the collarbone to from the sternum to the breastbone to the skull. Okay, so one of its jobs. So we're going to go ahead and do a compression. So we're going to go here, see where it attaches right there, and we're going to come right here and grab a hold of it. How's that feel, Stephanie?
You feel it?
She feels it. Let's turn a little bit lateral there. And we're pressing onto it. We're turning it at the same time. And we're pressing on it and turning on it at the same time. And then we're going to come up a little higher. And breathing and relaxing. And we're going to go all the way to it attaches onto the skull. So this is the National Self-Care Alliance Masters Course. And we're training people to fix every pain problem in the body. So we're training people to fix the pain at the top of the head, the forehead, the eyes, the ears, the teeth, all over the neck. Okay, so here we're looking for painful tight spots. So we're looking for painful tight spots in the sternocleidomastoid, and I think I found one here.
Yeah, you did.
So I'm just going to hold it and breathe and relax while I'm holding it there. And I'm turning her head to the same side for this muscle here. To the same side. And higher up. And to the same side. Good. And all the way to where it attaches onto the skull. Great. And we'll do a little teeny bit of cream on it. Not too much, just a little tiny massage on it. Great. Good camera work there.
Thank you.
Okay, so now we're going to go on to the little clavicular division or collarbone division. And it goes here, and again, it goes up to here. And so we're going to go ahead and press on that, and we're going to do it shortening and lengthening. And shortening and lengthening.
Oh.
Now remember, this causes some pretty wicked pain in the ear. Really bad in the ear.
I feel that actually.
And it causes balls of pain over the eye. So it's one of the muscles that causes really bad headache.
And which muscle are we on?
We're on the sternocleidomastoid, or the collarbone to the skull muscle. Or we like to call it the dizzy muscle.
That's what I was asking. That was the dizzy muscle.
We like to call it the dizzy muscle,
dizzy
okay, because it
muscle.
causes us to have postural dizziness.
Okay.
And you know, that could make you like you can't do anything. You can't work, you can't stand up, you know, it causes you to really be, I mean, actually they said that the postural dizziness causes much more trouble than the pain. The pain's bad, but the postural dizziness makes you crazy. So that one's much worse. Okay, so we're gonna again, here it attaches right here on the collarbone, and it comes up here and attaches onto the skull.
Can you try that again on the
So
camera?
right here on the collarbone,
Mm-hmm.
and then over here to the skull. So now we're gonna get right onto it, and we're gonna shorten it, and see, can it do its shortening job, and can it do its lengthening job? We're right on it.
Oh.
And does it do its shortening job? Does it do its lengthening job? And shortening, and lengthening, and shortening. Good, and lengthening. And right where it's attaching. Good. And let's massage both of them just a little bit. Okay, we're gonna give it a nice massage, and we'll give it a little massage while we're lengthening it. super. Okay, the second most likely one to cause front of the neck pain it would be the digastric muscle. So here we're going to go ahead. Remember, it attaches onto the inside of the chin, and then onto the hyoid, and then over here onto the mastoid over here, the same place where the sternocleidomastoid attaches, onto the base of the skull. So I could probably find a little picture.
Well, we've got the picture here on this one.
Yeah, we do have pictures over there.
Here's the picture on this one.
Okay, we could do that. Okay, good. There we go. So we've got a nice picture of it there.
Yeah.
Okay. And it causes front of the throat pain. Right here, front of the throat pain. But it also causes difficulty swallowing. Difficulty swallowing. So let's go ahead. We're going to get... So let's... Oh, it does. It can also cause trouble with some of its jobs. So let's have you go protrude your jaw and retract. Let's feel it retract. Yeah. There, and then protrude. And then retract. So you can feel it doing its jobs. Yep. Okay, relax, and open, and close, and open, good. And let's come up a little higher on it, and open, and close, good. Let's come up a little higher, yep, right there, right on it, yep, ooh, we found a spot on there, yeah, good. Let's feel you open and go to the opposite side, and this side, protrude, retract, there it goes, and protrude, retract. Good, 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 good. And open. Good. Oh boy. Open. Good. Okay, let's look on the other side. So let's go ahead. Let's feel. So let's feel under the chin. We're gonna come right there. So it comes from here under the chin to the hyoid bone, and then this way all the way to the base of the skull. So here we're gonna get right onto it. Right there. Open. And close. Good. And open. Good. And go right to. Oh, there it is. Oh boy. What do you think of that spot?
I can see your expression.
This also could make your jaw go side to side too. Yeah. But because one side sometimes works and the other side doesn't, and then so it causes some zigzagging. Yeah. So this muscle here might be causing a little bit of the. Yeah. Oh boy. Oh, can we feel that one? Yeah. We're right on it. We can feel those fibers right there. Okay, let's come up this way. Yep. Good. You can feel it working. And come up this way, up to where it attaches.
Oh.
It's also good to get right to where it attaches onto the bone. So it's nice to get the whole muscle where it attaches, and also through the belly here and through the belly there. In the belly, in the center of the muscle, is the neuromuscular juncture, or the juncture where the nerve comes to the muscle. And that's the spot that you want to clear out all those sensitizing chemicals out. You want to clear them out of the whole muscle, but especially there, so the nerve, when it comes to the muscle, can tell the muscle to do its job, you know, and get it to work. Okay, so the next muscle that we're going to look at is the medial pterygoid. So let's see, sign a nice picture, a couple nice pictures of those. Nice medial pterygoid pictures.
This one.
Now that's a nice picture from the outside looking with the cutout of the bone. Then here's a nice picture from underneath looking at the muscle there, attaching here and then attaching over here. So this is the jaw attaching onto the jaw right here, and then coming in and attaches onto the skull. So, so here you go. So let's go ahead. Let's feel this muscle. So it's underneath right here. Let's feel it opening your mouth and closing and opening and closing and opening and closing. This one could cause a lot of zigzagging. Yeah, because it can cause one of them works and the other doesn't. Okay, let's go a little higher and a little higher, a little higher. Right there. Yeah. Okay, now go side to side. There you go, side to side and right on it. Good. Okay, let's go to the other side. So here we're going to find the corner of the jaw. We're going to come underneath it, right there. So let's feel it. Yeah, go side. Good.
Oh, we have a question. If anyone knows where to buy Mosby cards.
Those. Okay, so where I got them, I went on. Like Craigslist or maybe Amazon. No, Amazon it must have been. So I went on Amazon, And then I looked for, and they only had used ones, so I took used ones. So I have 2 or 3 sets of those Mosby cards. This is a netter card, this one here, and they're good too. Those are nice too. Yeah, but they didn't have any of those Mosby ones new. But I like those the best. Those are my favorites. Those Mosby ones. Okay, right here, right on it.
Oh.
Yeah, right on it. Yeah, an open and close, protrude, retract, protrude, retract. Good. Side to side. Good. Okay, great. Okay, so let's see the smooth, how smooth the opening is, and close, and smooth opening, close. Very nice. Okay, so I feel the digastric, I think, is pulling on this side. So I'm just going to watch you open and close. Right, open. Yeah, right there, right there, right there, right there. And it was pulling you a little bit to that side. Yeah, right there, right there. Yeah, right on it. Right on it. Okay, just stay with your mouth closed for a minute. I'm just going to get right onto that spot. Right onto that spot. Yes, right there. Good. And then a little bit up this way. Okay, let's again open, close. Yeah, better, 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 better. Nice.
Yeah.
Opening. It's opening nice. So this digastric was pulling your jaw to the right side.
So not the masseter.
Yeah, the gastric over here. Yeah,
Wow.
isn't that incredible? Yeah.
Wow.
So it's good. Well, anyway, different muscles will cause trouble at different times, but it's good to see which ones are causing the trouble. So we got through digastric, your medial pterygoid. So those are the first 3, the 3 most likely. And remember, this medial pterygoid causes really bad sore throat. Really, really bad sore throat, and can cause significant pain in the ear. Really bad pain in the ear. So it's really important to getting rid of ear pain and dysfunction. So definitely it's a good one to learn. Okay, so the next one that's likely to cause would be the platysma. So it causes pain here underneath the chin as well. So we're going to go ahead and treat the platysma.
Okay, let's find it here on the
She's
chart.
finding it for us.
Okay, here it is on the chart.
It's the muscle sometimes that weightlifters might use when they're trying to really lift a lot of weight. When they're straining and getting a lot of weight. That would be, and it starts here on the chin, right through here on the chin. We're using pincer compression for this. And let's take a look at the other side. So again, you could grab the skin. Now, how do you know if you got it? Go ahead and do like you're doing a weightlifter. Do a weightlifter neck. Oh, I can feel, oh my gosh! You can feel it. You can definitely feel it. She knows how to contract that platysma.
I think she's a weightlifter.
I think so too. She really can contract it. You can really feel it. So let's come to underneath the chin.
And tell us how thin this muscle is.
Well, it's very thin. It's really thin, but it covers the whole front of your neck. Really whole front. But everyone's muscles are a little different thickness, so it's hard to know exactly how thick it is. But it's very thin. Probably as thin as your skin. Okay, so let's feel it. Let's stretch it. Let's give it a nice stretch. Let's feel what it feels like on the stretch. So next week we're doing back of the neck pain. And then, back of the neck pain. And then the week after that, we're going to do upper back pain. And then the one after that is going to do mid-thoracic, upper thoracic pain. And then we're going to do mid-thoracic pain. And then lower thoracic pain. And then low back pain.
And we're going to keep going.
And then we're going to do sciatica. And then we're going to do chest pain. And then we're going to do side of the chest pain. And then we're going to do abdominal pain. So that's all coming up. So that's up and coming this summer, this spring and summer. Yep, that's what's coming up. Okay, so our next muscles that we're going to treat, what's the next most likely one to cause front of the neck pain is the longus coli and the longus capitis. So we're gonna I have some
You
really
have a
good
good picture
pictures
there?
Yeah, and I
I
got
got
some
this
good
one?
pictures here. You've got some over there. So we're gonna take a look at the longus coli and the longus capitis. So let me. So come take a look over here. Oh, I'm gonna put over there so there's more light. Okay, so you can see here's the longus coli right there, and the longus capitis here. Okay, and we're going to treat them. You see that they span a few vertebrae, and if they're tight, they can cause dysfunction of the discs and the positioning of the vertebrae. So they're important in a lot of things, but they also are important because they can cause significant back of the neck pain, significant ear pain, significant eye pain, and pain throughout the front of the throat. So this is an important muscle in all kinds of pain problems, and you almost never see it. It would be uncommon for hardly anybody treats it, hardly anybody. So here it is. Here's your esophagus. You're going to you're going to feel it and sort of push it aside and go right where it used to be, and that's where we're going to start. Let's go find it and push it to where it used to be, right there. And find it, and then go to where it used to be. And again. Oh, a little bit too much there. Okay, so let's go right here. Yours is working really good. I can feel it. Can you feel how it's working?
Yes.
Okay, now I'm going to take it through its job. So it goes chin to the collarbone and stretch. And so here, let's do the longest part, the longus coli part. Chin to the chest. It's doing its job. And now let's just do the longus capitis right here.
Which is a little bit lateral.
A little bit lateral, right there. Okay, so it's looking very good. You've got a wonderful longus coli.
What a compliment.
I'm very impressed. So here I'm contracting it, and I feel, oh, it's doing
wish
its...
they did as well.
Oh, yeah.
And here we're contracting, so it's doing, oh, I can feel it's doing its job. So it's doing its job, I can feel it, okay? And here, oh, I feel a little bit of dysfunction right there. What do you think of that spot?
Yeah, that's the spot.
Okay, so I'm shortening it, and I can feel, so how do I know that part wasn't working? Because see, I can feel that it's not contracting. So I can feel that it's just like stuck. It's like going boing, you know, instead of doing contracting, it's just resisting contracting. So I know that that part isn't functional. So we want to see if it does its stretch, and we want to see if it can do its contraction. And right there. And so here I'm on the longus capitis now, a little lateral here, and then one here, right there. Can you feel that?
Yes. Oh.
And again, this causes pain really bad in the back of the neck. It's usually can be the cause of unexplained back of the neck pain because no one treats the front part. It can be causing pain in the front of the neck. It causes ear pain and eye pain. So it's a crazy, crazy muscle, isn't it?
Mm-hmm.
So we took a look at that, and it seems you're doing very good. There was a couple spots. So I just say you should probably just make sure that you can get these spots
Okay, we
to
have a
contract.
question. Is
Oh, go ahead.
Stephanie lying on Fomentec only or something in addition?
No, just the Fomentec.
Just the
one.
Fomentec
It's
bag.
just this the Fomentec. You got hot water in it, warm water in it right here.
Here.
It's right there. Yeah, just the Fomentec bag. Yeah.
Okay, lot going on right now, so let's get...
So I can feel on Stephanie there's a little bit of dysfunction, but it's pretty good. Okay, I feel it right here. So right there, the lateral, the lateral capitis. You can feel that right there. Yeah. So, but very good though. Did it feel pretty good to you?
Yes.
Yeah. So she liked it pretty good. Okay. Next, we're going to take a look at the supra and infrahyoids.
Okay, I've got a picture here. Do you have another
Oh, yes, I
color
do have some
one?
over there on color. Yes, I do. I got a nice color one.
Comment,
they
yes.
did. Okay, so here, oh, I'll put it where we can see it better.
Okay, here we
Okay,
go
so
with
here-
another color picture.
Okay, so this is the supra and infrahyoids. So this is the so above the hyoid the hyoid bone is called the suprahyoids.
Check
Below
that
the
bone.
hyoid
See
bone
that bone there.
is the infrahyoids. And you see how they attach down here onto the sternum and to the clavicle. and also they attach on to the hyoid bone or to the thyroid right there. So we're going to go ahead and treat those strap muscles. And here's that one, the omohyoid, stretches onto the hyoid and then over here to the scapula.
Okay, show where that starts and ends
And
again?
then here starts on the hyoid,
Yes.
and
And then
then
it
it comes
goes.
over here and attaches over here onto the
Attaches
scapula
to the scap.
and also onto the first rib.
Okay.
Okay, so we're going to take a look at all those muscles. So to find them, I usually find the esophagus here and then go right over them, and then go ahead and I grab more than I did when I was doing the platysma. And you could feel I'm grabbing a lot more, right?
Yes. Definitely.
Yes, she is grabbing a lot more. Okay, so I'm holding it because I noticed it's taut there. I know, so I can feel that you have some taut bands in this one.
And you're
Okay.
moving it around.
And I'm giving it a little bit of motion. Okay, so now we're going to come up a little higher. So I can feel it right on that strap muscle. And it's coming up to the hyoid there. And we're coming up a little higher. And we're coming up to the hyoid. And this is a little bit stressful, isn't it, Stephanie? Yeah. A little bit stressful working on these.
Yes.
Any precautions to keep in mind when treating this area?
No, nothing. Especially when you're this superficial, we're really nothing. We're just way over the blood supply and the nerves and stuff. So we're just really, we're right on the. We're just below the skin and into the muscle. We're not actually in the areas to be concerned about. Yeah.
Question is pain level.
Pain level. Well, pain level, I think what we're doing is we're going through the pain and we're looking for painful areas. So we're looking to press on the painful areas. So here we're looking at the painful so we're looking, oh, that's not painful, or we're going to the next area. Oh, now we find the painful area. So we don't want it to be so painful that they tighten up their body.
They said,
Okay.
okay. That was our answer. Okay. I said, okay.
So we don't want
Stephanie, do you have a pain level here?
So
Okay.
So we're looking to press on the muscles that are painful,
They said, "John."
and we want them to press in such a way that it doesn't make the person feel too much, suffer too much, and cause them to tighten up in other areas. You know, so you're doing, so but we actually want to address the painful
See,
muscles.
she's
yeah.
very relaxed. Look at that.
Mhm. Okay, so here we're right over the esophagus. Now we're grabbing right onto the muscles. Oh, I feel, so on this side it's not as tight as it was on the other side. Yeah. So the digastric was tighter on this right side, and these strap muscles were also tighter on the right side. That's interesting.
Mm-hmm.
And is she right-handed?
I am.
Does that make a difference?
Well, it could, but it wasn't. It's not always the same.
Okay.
Sometimes it bothers her on one muscle, sometimes it bothers her on another muscle. So, okay, so now I've got a real tight area here. So I'm going to just move it around a little bit. And she notices it painful
She's
there.
doing some good
Yeah.
breathing.
Yeah, it was a little bit painful there. Okay, good. So we're going to take a look at that omohyoid. So let's go ahead and feel that over here. So
Oh.
she noticed that spot where it attaches onto the scapula. So that's its attachment. And then we're going to come this way. And to its attachment onto the hyoid. Okay, let's come over here. Again, you're going to see the little muscle right there. Give it a little stretch. Right onto the scapula. Right there. And then we're going to come this way. Okay, so right here, if we're pressing into the neck right here, so if we're lifting up, we don't have to be concerned about anything, because we're lifting up pretty much. But here, if we're going to be coming right over the blood supply, if you feel it pumping, then we want to get off of it. So
Okay, we have a question for Stephanie.
Oh,
How
Stephanie.
sore are you right now?
How sure?
sore.
Sore? I'm not that sore, actually.
Okay.
So sore, like so. What maybe
Painful.
is the treatment painful or should?
I
It's
think
just
that's
certain
kind of the
spots.
question.
Yeah. Well, do you have any pain problems before you came in today that you want to tell about?
I had some sore throats the
she
past
did.
few days.
She did have a
So
sore throat in the past few days. Okay, so these muscles here, did they feel a little tender?
They did before. Now it's not as bad.
Not so much. Okay. Okay, so they could have caused it. Also, the digastric might have made you feel like you have like something in the throat.
Yeah.
Yeah. So we treated that on this side, and that was helpful. Okay, so let's do the suprahyoid. So these are the muscles that are above the hyoid bone. So let's go ahead and we can give those a good pincer compression. Get them right here.
Is the exhale not necessary when treating this area?
Well, you know, when you inhale, it's always good to breathe along with all the treatment that we're doing. So if you can just go ahead, if we can do the abdominal breathing while we're working is good. So the tummy goes up and down, and the neck doesn't get tightened while we're breathing. So that's important. And that's a really important underlying perpetuating factor.
How long is a normal treatment time?
Frequently, I'm treating people about 45 minutes and training them 10 or 15 minutes. Just depending on, but it wouldn't be, you know, but so maybe you might spend a quarter to a third of the time training them or half the time training them, depending on the person and how much we're working on it that day. Yeah. So let's give it a nice massage here a little bit.
Great questions. Thank you.
I'll give it a little bit of massage. Get underneath here. What if you have somebody with really bad chronic neck pain? And how long would it be before they're better? It often would take a month, maybe a month and a week, to 2.5 months to fix a really bad chronic neck pain. Some up to maybe 3.5 months. So somewhere between 1.5 to 3.5 months, you can usually get rid of almost any kind of chronic neck pain. But what if the person has some underlying perpetuating factors that are causing some of the pain? So what could they be? What could some of those underlying perpetuating factors be? Well, they could be short upper arms. That might do it. They might have their head forward, and that could cause it. So that could be important. They could have first metatarsal deficit. They could have one shoulder higher than the other, and that could cause all kinds of trouble, right? We found that on you today.
Right.
So he had one shoulder much higher than the other. Then we put in the first metatarsal lift on both sides, and then it made him real strong and real functional. So that was really good. So so that could help in all kinds of neck pain and dysfunction, correcting your feet. So correct your feet for your neck.
Whoa.
And they want to know how many times a week are you treating in that
Frequently,
3-month time frame?
Usually I'm treating them once a week, but they're treating themselves every day.
Every day.
Every day. So they should be getting good treatment every day. So, Stephanie, so that's all we're going to do on you today. Okay. So we're going to have you go ahead and get up, and we're going to have you turn to one side, and then get your feet over the side, and then just put a little heat on your neck there, and just have you go ahead and sit up. So we treated all the muscles that cause front of the neck pain. Is that great?
Yes.
Yes.
We did. We
They said,
treated
thank you, Stephanie.
yeah. Thank you, Stephanie. So next we're going to do just again some little range of motion exercises, and so if we think of all that, so it's nice. One way to do range of motion exercises is to have a little bit of music. So Stephanie, do you think you could put a little bit of music on for us? Yeah, that one's okay too. Okay, so we're going to do a little bit right now. It's nice to put music on because what you want to do is do little silly movements to something so that you really get it in. So we're going to go ahead and we're going to do ear to our shoulder again, and up, ear to shoulder, and up. Okay, louder, middle,
Thank
Get
you
a
so
rhythm.
much for these classes. I'm learning so much. You are
Good.
welcome.
Okay, now we're going to turn to the side, look to the right, middle, left, middle, right, middle, left, middle, right, middle, left, middle, up, middle,
Down,
middle, up, middle,
down,
middle, up, middle,
down.
middle. Here to the
Same here.
shoulder.
Very grateful. Okay. Thanks.
Okay, and we're going to open and close, open, open and down to one side, and down, open, and close, and open, and close. Good, so it's nice to have some music to do that with, right?
Yep.
So did it make it easier? So because earlier we did it without the music, now we did it with?
It's more fun.
It's more fun, right? Right. Okay, so if you can take a look at this picture right here. Here's some of the underlying perpetuating factors in front of the neck pain. Okay, well actually all neck pain, but paradoxical breathing, short upper arms, first metatarsal deficit, leg iniquity, small hemipelvis, poor posture, sleeping, sitting, standing, the head forward positions, all positions straining and looking at your computer screen, looking down at your keyboard, bird watching, kyphosis.
Can you explain what kyphosis is?
So kyphosis would be like this. So someone sits down, and immediately after sitting, they go like this. So they just have to, their chest muscles, they're like this, and they might be sleeping all night like this too. You know, so they might be sleeping like this, so they might get kyphosis from sitting and looking at their computer and looking
So
at little tiny-
kyphosis is right in
So-
here.
so-
You're
so-
rounded.
So this is, yeah, all rounded.
You're rounded
all
right here.
You don't have the proper lordosis or the proper curve right here.
And the lordosis is
Is
at the
this-
lumbar.
is having the curve this way,
Mhm.
not the curve that way.
Right.
Okay. Okay, so the next one would be short scoliosis. Oh, here, kyphosis, then leveling the neck, shoulders, seated, standing, and shortening of structural asymmetries. Scoliosis, short pectoralis, short abdominals, shortening muscles in the face, neck, shoulders, chest, hands, back, you know, that can cause asymmetries. So different asymmetries that can be caused by other muscles. So say for instance, if you have the QL muscle here contracted, and then you have
And
to keep,
QL is
Oh.
quadratus lumborum.
well, it sure is. So this
For
muscle-
those who don't know, QL.
So the muscle that brings your hip up,
Okay, let's get some hip action here.
the,
Go
the
ahead.
muscle that brings your hip up, or the muscle that brings your torso down, or also that helps you to extend back that muscle right here. It could be tight, and then you're leaning this way, and then all the muscles on this side are likely to be tighter because you're leaning that way. So there's so many different things that can be underlying perpetuating factors, and one of them can be the way you sleep. Okay, so I thought maybe we might look at sleep position for a minute. What do you think?
Sounds good.
Sounds good.
Because you know, neck pain, sometimes don't we wake up with stiff neck,
Right.
stiff painful neck, and so this is be important to what position you get your neck in. So let's
Did
try.
we finish everything on that page?
Well, we did, yes.
Okay, we sure did. All right.
There's a lot more even than this. Yeah.
Okay.
There is a lot more. Okay, so here we're going to go. So one thing that we do is we have, let's use the body support system for a second. So what if we had pillows at home that we could do? So here's the body support system, and we're going to cover it like this. So would you like to lay down on your side? Put your shoulder in this little crevice. So you see how when she's laying down, there's like a pillow in the front of her, right here, and there's a pillow the same like that in the back of her, because this is so. At home, you might stick a little pillow in the back and in the front, And then you want a pillow high enough underneath the neck that your shoulder has space. And then you could use this McKinsey roll, and you can see this is a McKinsey roll. You can get that from OPTP or maybe from Amazon.
Or Massage Warehouse.
Oh yes, of course. Massage Warehouse has it. A lot of people have it. And so this would be, now here, now you're not scrunching your shoulder all night. Now, another thing is you could use a pillow. Now a lot of people have a pillow and they put the pillow in front like this. But what happens a lot of times is now the front part gets tight. So you get dysfunction of the front part here. So what I like people to do is to put their arm like that on their pillow like that. Or another way to do it would be to put the pillow sort of behind you, and instead of going like this and getting your whole shoulder to scrunch up here and get kyphosis and cause neck pain and dysfunction, you just go like this, and now the neck's being stretched, the chest is being stretched, the arm isn't shortened. So now, what if you're saying, well, I like to put my arm around my significant other? Well, then I had a couple, and both of them had shoulder pain on the same side from doing that. Okay. Okay. So I said, now your significant, now he can be behind you, and you can put your hand on him like that, and then he could have the pillow behind him, and he could put it behind. So I gave him some alternative ways that they could sleep. They could sleep together without hurting their shoulders. So.
And what about pillows between the knees?
Well, that could be useful, and that could be nice, especially what if you have pain here, and by having the leg down, it causes you to be painful here. Then, but if it doesn't, if you don't have any pain here, it could be okay not to put the pillow between your knees. So it could be but what we want for the rest of the body too is to unbend all the joints. So don't have this kind of like this. Don't go like that. Okay, unbend the elbow, unbend the wrist, unbend the hip. So don't have the knee like this, because a lot of times you're sitting all day, and then you're sitting all night too. Like put both knees up here. Like people will do this, and so they're sitting all day, then they're sitting all night. Okay, so what I want you to do is not make it straight, but let's unbend the knee, let's unbend the hip, and they don't have to be straight, but just not bent all the way. So let's unbend in the neck, unbend in the chest, unbend in the arms, unbend in the hips, so everywhere. So this would be a nice way to sleep.
So what are the names of the double pillows? Where do you get those?
Okay,
'Cause
all right.
This looks
okay.
great, right?
Okay, so let's have you stand up for a minute, Stephanie. Yeah, thank you. So this is not, this is something that therapists usually buy, but you could maybe recreate this with something at home. You could have a stiff pillow here,
Right.
then you could have one of these McKinsey rolls, which you can buy pretty easily, like she said.
Right.
And then another pillow. See, when you lay here, it's really a pillow here and a pillow here. So sometimes what I do is I just have a little pillow like this, and I wedge it here, and I wedge another one there. So this would be like something like you would like the inside of a pillow that you would use on a couch,
Right. Okay.
and put a pillowcase over it, and then I just stick it like underneath.
Right.
So suppose, Stephanie, we didn't have this body support system, and we wanted to help, so we could put a pillow here. Go ahead and then lay down, and then go ahead and lay on your side. And then we could put the McKinsey roll under her neck, and then we could maybe wedge a little pillow here, and wedge a little pillow there, and maybe have something, another pillow that you could raise, let her arm lay on. Did you want to see too? Oh, there. Okay, good. Okay, so this is great ways to figure out how to sleep, without a lot of pain and dysfunction.
Excellent.
So this would be great. How's this feel, Stephanie? Comfortable? Pretty comfortable? Yeah. So this is we were looking at some of the underlying perpetuating factors, Justin.
I don't believe in underlying perpetuating factors.
You don't
I-
believe it?
No, I think they should just keep having their problems come back over and over.
So
And
they
then-
can keep coming back.
Yeah, that's it. I mean, isn't that the whole
So
point?
it's, yeah, this is, that's true. Yeah, that's true. Yeah, that's true. We just want them to keep coming back.
But
Plus, this helps them from
Yes.
switching into a bad position too, though, right? I mean, it
Yeah.
looks like you could sleep that way for quite a
Well,
long time.
A lot of times when you wedge the pillow here and wedge the little pillow there, it kind of like gets you into that spot. And you just feel like, oh, you're in a little cocoon, and you just feel really comfortable. So it does help quite a bit. Again, the thing you don't want to do is
Yes.
get this hand up here like here, because we're using the computer all day. We got the arm bent. We don't want to have the arm bent all night, so we want to unbend that arm, and that's going to help us quite a bit.
And then don't pull your knees up.
What about what?
Back sleepers.
Okay, so I was leaving out back sleepers.
Ah.
How could I leave out back sleepers? Okay, so for people who sleep on their back, so let's go ahead and sleep on our back. So we think people sleeping on their back is really great. So go ahead and lay on your back. So you could probably have a thin pillow to lay on. You could have also the McKinsey roll. How's the McKinsey roll feel? So you could have a thin pillow, but often it's nice to bend the knees a little bit. So if we have the knees bent just a little bit, if you're laying on your back, that could be good. So you can go ahead and put something maybe a little thicker than that. But go ahead and we can. So that's often good. Okay, bend a little bit. Yeah, good. Okay, so now sometimes the arm, this is too straight for the arm, so it's nice to maybe have just the arms up on a little pillow. You got them right there? You got one here. So sometimes just having your hand up on something like that, like this, could feel comfortable. What do you think?
that does look good.
So it just makes you feel comfortable. Like this is one way. Also, you could do. Is there a couple more of those little wedges? Yeah. So you could, to make yourself comfortable when you're laying on your back. Sometimes it is still good to come like that. What do you think?
Yes.
Good night.
Okay. So does it feel like you could sleep on your back this way?
Yes.
Now, do you sometimes sleep on your back?
I normally sleep on my back, but I've some
Good.
of these little issues keep on around.
Sometimes. So this can help you to feel more comfortable. Yeah. And then sometimes if your arm is slightly bent, it's nice. Yeah. Good. Okay, so this is a great way. So this is covering one of our underlying perpetuating factors, sleep position. Yeah. So you could have a thin pillow under the head, or sometimes some people don't have a pillow laying on their back. So what do you do sometimes?
I normally have a pillow, and I have a McKinsey roll too.
Okay,
but
so a thin
I have-
pillow.
yes, but I haven't elevated my knees or.
Uh-huh.
This has been too straight.
Oh, it's a little bit too straight?
Yes.
Okay. So this makes it feel just a little bit more comfortable.
Yes.
Yeah, so how long does it take sometimes for people to stop laying on their side and lay on their back? It sometimes could take 3 or 4 weeks of trying it every night. And then finally people could do it. Yeah. Don't you know somebody that learned to do that?
Yes.
Yeah. It took them a few weeks, didn't it?
Yes.
A month or something. So everyone should go ahead and try it tonight. Try using little pillows. And again, I just use the insides of like pillows that you use for the couch, the inside part. And I put a pillowcase around them and I scrunch them in different places. And they're only a few dollars, and you could use them all over the place. Yeah. Okay, so we're getting close to the end of our